So welcome to this new episode of The Rumble. My guest is a lady formerly from Raas, now from Delhi. She's wears many hats. She's a therapist. She also handles alcoholics, drugs, rehab, Reiki healer, which is an interesting thing. I have no idea what they do. So now, welcome to the show, Meena.
Hi, thank you.
And you're a Delhiite from Madras, or a Madras person now from Delhi. Which way is it?
I'm Tamilian by birth.
Okay.
Sorry, by how do I say this? I was born in Delhi.
Okay.
But I am from Tamil Nadu.
Oh, you belong.
And I lived here for 13 years. I moved back to Delhi in 2008.
Okay. Did your profession take you there, or you just had enough of Chennai and just said?
No, I was transferred. At the time, I was in a regular corporate job. And then I moved to Delhi, and then I made a complete shift into all of the things that I now do.
Okay, how did that happen? I mean, you're in what field were you in earlier? Corporate, when you say
I was in advertising.
Okay.
Yes.
That gives you a scope to see a lot of alcoholics, a lot of drugs.
Yes.
I mean, the advertising industry is a sort of feels good talking about how
advertising, media, all of these fields.
Yeah, drug abuse is rampant in that industry. Any more than any others?
I don't know if you can say rampant, but yes, one does see a lot of recreational drug use, party drugs, but a lot of alcohol, certainly. And it's very socially acceptable for men and women, to let their hair down.
Since you lived in both parts, where do you see more abuse? South India, in Madras, did you see a lot of it? I mean, people watching this interview would like to know. I mean, do we have the same problem in Madras as they?
I think you do, yes.
Yes?
Yes.
In your personal experience, you've come across a lot of them who need help?
Yes, a lot of partying happens. A lot of things go awfully wrong. I think there's a lot of drunken driving. There's a lot of social consequences like marriage breaking up. All sorts of things happening because of addiction and addictive behavior.
And what drove you into this from being in the advertising field? How did you make the switch? Or
I sort of made a slow kind of a transition. So I was based in Delhi and I started doing a little bit of soul searching. I started doing some self-help programs. If you've heard of landmark education.
Okay.
So I did some work on that. And then I found I wanted to make a change. So I sort of went back to school. I studied psychology. And then all of this spiritual healing really interested me. So it was a very gradual transition. For a while, I was a motivational trainer. I've done a year-long program for college students. Kind of discover your best potential kind of program.
Are college students receptive to this sort of thing?
Yes, certainly. And they need it. They really need it.
Yeah, I had a young lady the other day who's also doing this kind of motivational thing, and the only topic she talked about, and she talked about it extensively, was how young women, she can talk on behalf of women, how they suffer extensively due to these boyfriend relationships, and they go into depression, and some of them want to jump off the top of buildings, and how that realization made her into, teach people how to handle stuff. These are really things that are happening because my age, we didn't see all this. Or if they were there, it's well hidden.
Yes, a lot of relationship issues. Even I meet a lot of people going through relationship problems. And I think it's a product of our times. There is more openness and more opportunity to experiment. But at the root of it is that people are confused and all of these problems result because of that. However, coming back to addiction, one thing that goes unrecognized a lot is relationship addiction. People are in multiple destructive, toxic relationships. And that's doing a lot of harm. And there's very little awareness about it.
Do you deal with people suffering from that too?
Yes.
So it's not only substance abuse, it's
yes, relationship addiction is rarer. Sometimes it goes hand in hand with substance use. The substance use is more in your face, it's more apparent. So if a person's getting drunk or high,
offensive behavior,
yes, that's visible. At the root of it, recently I worked with somebody who has substance addiction, who gambles addictively, and who's in multiple relationships, has all of this because the root is the same. Okay. It's addictive behavior.
And do they confess to it? How do you come across them?
Initially the family comes to know. So the family will probably come and say, my husband or my son has been getting drunk, he's been gambling, he's been betting on matches. Or
police grabbing him, police are locking him up.
Drunken driving.
Yeah, those kind of things.
Yes. And then the person himself or herself has to confront it one day. Sometimes there are health issues, like the liver gets impacted, people suffer from diabetes, hypertension, a lot of lifestyle diseases that are related to alcohol and drugs.
Okay.
So it takes various forms, but the beginning of the end, you can say, or the beginning of the solution is the person himself or herself understanding.
But how often does that happen? I mean, I've seen drunks go drunk throughout their lives. If it happens, it's like a very rare case. So do you actually bank upon them coming forward and saying, listen, I've got a problem and help me? Or do you rely mostly on friends?
If they do, it's fantastic. But if they don't, then sometimes their family drags them to a rehab or to a therapist or just for a counseling session. For example, if it's a substance like, say, marijuana or cocaine, the person could just lie and say, I've never taken it.
And besides, that would be very rare, Meena. Wouldn't it be? I mean, cocaine addiction in India, is that common? I mean, I'm talking somewhat ignorant, but is there enough for us to worry more than alcohol addiction?
Certainly, there's a lot of cocaine, brown sugar, everything is rampant, and it's a very simple strip test. It's a urine test which confirms whether the person has used the substance in the past 2 months or not. So if they have been lying to their parents and saying no, and money's been disappearing, all the person needs to do is take one simple test and all these.
Sample urine and that's it.
That's it. All of this, and it's within the past 2 months. So if the person's had a joint or snorted up a line.
That long it stays in your bloodstream?
Yes, it does. Yeah. So detection is easy. The harder thing is the subtle difference between addictive overuse and recreational use. There could be people who do it once in a while at a party.
Get together with friends and have a laugh and drink some.
But for the addicts, it's a matter of life and death. Everything gets destroyed in the end. Your career, your marriage, your relationships, your
the family,
health,
wealth.
Everything
goes for a toss.
Yes.
So when the parents come and complain, do they just come to you offhand, or they bring him along first time? Or is it you have to do one conspiracy thing?
Some of them are like, they tread very carefully around this problem. So they call me, once they look at our website, they give me a call, they want to come and meet first, and then they want to, test the waters, then bring the person along. They come and meet me and they find, I'm an easy person to talk to, or so I think. So they meet us and that's how it is. Sometimes the wife comes, or the father, mother, a sibling.
How do they find you?
We have a website, that's www.lifeskills.co.in, and we figure in the de-addictioncenters.in, which is a portal that lists all the rehabs in India.
Okay, and is this a licensed kind of trade, if I want to call it that? Is it a licensed thing, this detox centers?
Yes, it is.
Government certifies you that you are capable of doing this.
Yes, plus de-addictioncenters.in is sort of like a private body, so they come and verify the center, they do surprise checks.
Okay.
So you have to meet certain norms, like you need to have a physician on call, you need to have a psychiatrist on board with you, because sometimes people have other psychiatric complications in addition to addiction. Like I've worked with somebody who suffers from, say, bipolar disease and alcoholism. So the two symptoms mimic each other.
What do you do? Pour drinks in both hands? Bipolar addiction?
It's very scary. It's very, very scary.
What happens in a scenario like that? If anybody could recognize it, if you were to describe it,
what one needs to do then is that the psychiatric illness needs to be treated with medication, the medication absorption needs to be monitored, and the addictive behavior needs to be handled with the counseling and therapy and all that we do.
Okay. Yeah. So you've heard it from her. It can strike anywhere, anytime, and recognition is the first step. So I guess families better be, keeping a good sharp eye on their children. See, and we'll find out how can they recognize. What are the telltale signs of somebody slipping into addiction? Let's find that. So the other important thing is, how does the family or whoever the concerned person is, and I say concerned person, not in the governmental thing, the concerned authority, I don't mean that, the person who's concerned for that guy, how does he know this guy is now in a dangerous situation? What are the telltale signs? See,
we say that he starts becoming dysfunctional. And this dysfunctionality could be anything. It could impact his health, for example.
Okay.
So if he's suffering from headaches or he's suffering from some kind of
then you take
physical
him to a doctor.
symptom.
You take him to a doctor. Why would you take him to a detox?
No, but the family would know if he's drinking these huge amounts. Also financially, so if it's a student, or large sums of money are disappearing, huge credit card bills from bars, those are indicators. And then the person's behavior begins to alter. Sometimes it's subtle, sometimes it's overt.
But is there specifically something that will shift because of alcohol consumption, or is it just like generally behaving badly?
Two things could happen in the case of alcohol. A more aggressive person will become angry, losing his temper. The appetite goes down, so they don't eat properly.
Okay.
Dinner is usually a meal which they will try to skip because they want to keep drinking. Similarly, with the drugs like marijuana, if it's a student, the studies will suffer, grades will not happen,
But the popular perception is that college students keep saying, I'll study hugely better.
That's a myth.
And I can concentrate, I can do this, and it creates awareness and all that when I have a joint. But it is a lie.
Madhav, there's lots of myths about marijuana, and you'll find a lot of marijuana smokers making statements like it's been legalized in so many countries and it's good for
health. How do you account for that? A concerned country, it's stickler up for all these things. America made it a legal drug.
Essentially, there's nothing wrong in recreational marijuana use. So if you're going to have a joint at a party or at a concert, that's fine. But for the person who's addicted, it's enough to ruin his life. I've worked with students who spent 4 years in a college and not made even one credit.
Okay, so if I ask you straightforward questions, as the audience would like to know. Yes, you recognize that somebody in your family or yourself,
yes,
you are on the edge of trouble. What should they actually do? Go to the website, look at your place, or what is the way that they can get help?
See, mostly they search for rehabilitation websites. So there's a portal called www.deaddictioncenters.in. That's the India URL.
Okay.
And it lists many different kinds of rehabs.
And do you list what you're going to do in those places, in those sites?
Yes, it says what are the treatments offered. So typically, for example, in the place that I run, we work on the 12-step program, which is the foundation of any good recovery program.
Okay.
To that, we've added Reiki healing, we've added hypnotherapy, we've added guided meditation, yoga, martial arts, and a whole lot of other things.
Oh, martial arts too?
Yes, that's right.
How did that help?
It brings a lot of discipline.
Okay.
And the breathing and meditation part is really good for alcoholics to calm down.
Okay, I thought you teach them martial arts, they go and kick everybody's ass after they have a couple of drinks. So they can go and see what really happened. But can they see what is the daily, lifestyle inside one of these places? This.
See, the family comes and visits usually. Family will come
and
ask.
If you were to describe an average day, what would they be doing?
So our routine, for example, so they wake up and let's say we follow a slightly relaxed schedule because 80% of the people who are coming to us are people who are willing to go into treatment.
Okay.
Right. So they wake up at about 7 o'clock. It's not an unearthly 5:30 wake up that we have.
Okay.
So they wake up at about 7, and once they're done with their chai and everything, and then there is an exercise routine. So thrice a week we have yoga. Twice a week there's aikido, martial art.
PT kind of thing.
No, regular exercises.
Okay.
And then they also have an option of using the swimming pool or the gym. That's for their own exercise. Okay. After that, breakfast, shower, and there is something like an input session. It's called. It's like a lecture session where they sit and listen to what these what this problem of addiction is, how to overcome it, what are the behavior traits.
And you do this every day?
Yes, every day.
Every day they're going to hear from you what kind of problem they have,
there's an ocean of information out there.
Yeah, do they sit still and listen?
Yes, they do. And different people are receptive to different things.
Okay.
So we go through the whole 12-step program. We do a lot of behavior-related talks. And also a good bit of motivation, saying you can do it. Okay. So many people have done it, you can do it. And then of course there's lunch and a siesta break.
Do you have reformed addicts?
Many.
Being part of the treatment,
yes.
The crew which actually...
They come, we have meetings twice a week. These are very therapeutic.
Okay.
So the people who are, we say, ex-students or ex-patients of ours, they come. It's fantastic for them. They keep in touch with the program. And it brings what we call humility. Saying, so they don't...
I was there and now I'm out of it.
Yes.
Yeah.
So that's really helpful.
And another critical thing is, what does all this cost?
What is all this?
Cost.
See, rehabilitation in India, the price range is from 10,000 rupees a month to about 5 lakh a month.
Wow, so what do you do with 5 lakhs?
That's the range. So depending on the facilities, whether there's air conditioning or not, whether there's what kind of, the rooms are, that's the kind of...
Oh, the usual thing. It's not the treatment that makes a difference, it's the...
See, the facilities cost. What we have is different in terms of the system itself. Okay. It's like we can, for example, I could have somebody staying with me who goes and does a business meeting and comes back, or who has email access.
Okay.
That's, if I can say, not available anywhere else in India.
Okay, you allow all that?
Yes, that's right. So our cost would be similar to say living in a serviced apartment anywhere in any of the metros, say 2,000 to 3,000 rupees a day.
It's almost like a very discreet treatment for some mental disorder which you're not telling anybody, but this is what he's going through.
Yes.
So everything looks like a normal kind of guest house kind of feel, but it's therapy.
Exactly, and that whole social stigma thing doesn't become so much of a stumbling block.
That's probably their what should I say, the key to success. Nobody wants to admit that I'm undergoing therapy and treatment. You look like crazy guy. So this sort of place would be the one to do. So when you come back and find out what else do they do. She's talking Reiki, and I don't know how that impacts on addiction, but we'll find out. And in an average house, family together, what are the kind of odd things that are also leading to these kind of substance abuse? I heard you say codeine. Codeine, as far as I know, was what people use for a headache.
No, codeine is what is found in a lot of cough syrups, like if you've heard of Corex.
Yeah.
So
that's for kids. I mean, regular expectorant.
No, but people abuse codeine. They drink cough syrup for a high, and huge quantities of it.
Yes?
Yes, and the quantity progressively increases.
Why don't they just go buy a bottle of booze if codeine costs, Corex costs this kind of money? Or is it that this looks innocuous and nobody will ever find out?
See, one is it's a different kind of high, if we want to get into it. Things like codeine keep the person very numb. Alcohol gives them a sort of, little bit of they feel that they're getting an energy high and they want to talk loudly or they want to dance or they want to,
Yeah.
But with codeine, it's more like they feel just calm and, comfortably numb.
Okay.
And they go on, they get so used to it that they can't live without it.
What are the other things that could be used in similar manners domestically?
Substances, domestically, a lot of painkillers. There's Proxivon. In Punjab, Proxivon addiction is very high.
These are over-the-counter
you need a prescription, but you know how things are. You can.
Yeah, prescription you can get anywhere.
Yes.
And what else?
Alprax,
just for parents or friends to just watch out for these things in the home.
Yes, Alprax is a widely abused drug. It's anti-anxiety. Also sedatives like Campos, Valium, all of these.
Yeah, but how would that become an addiction? You put you to sleep in any case, isn't it? Isn't that what Campos does?
They consume progressively higher quantities of it. Also, if it's used in combination with alcohol, then it will give a different sort of a high. So all of these are widely abused.
And then you said you also use hypnotherapy. That was a kind of word, I don't know what it really means, as much as I am ignorant about Reiki. So how do these two things, you use them in your therapy?
Yes, we do.
What is it? Yeah. What is it exactly?
Okay, so hypnotherapy is to unlock what's in the subconscious mind. Because as far as regular counseling or cognitive counseling is concerned, two people sit across the table, and if you've heard of the classic, the person's on the couch and talking about their life.
Yes.
The limitation is they only talk about what they think is important. They may not even be concealing anything, but they talk about what they feel is relevant and important, and sometimes that's not enough. For example, if a person has had something traumatic happening to them at the age of 6 or 7, that can lead to an addictive behavior
Yeah, sure.
later.
Half the movie plots are all based on something that happened to you when you're 6
But
and 7.
the funny thing is, the sad thing is in the movie, the guy comes and takes revenge. In real life, he or she forgets.
Okay.
So when we open that chapter of their life...
So should you be leaving it alone instead of opening it up?
When we open it, we heal it. And that helps to process it emotionally.
Can I stick the knife into you? I'll fix it, but can I just stick it once more into you?
No, it's funny you're saying that, Madhav, but sometimes there's a lot of catharsis, there's a lot of emotional release that happens, but it's very productive, it's very useful. So hypnotherapy helps with this. The other thing, very important thing with hypnotherapy is we say that for addicts, there is an emotional void which that substance is filling.
Yes.
Which is why a person, yes, so if you tell an alcoholic, let's go see a movie today, why do you want to have a drink? That movie just won't cut it. That movie will not give them...
It's not an equal substitute. Yeah, true.
Exactly. So what is the real emotional void? Does the person want fame, for example? Or does a person, is he or she not happy in their relationship? Okay. What is the real reason they need to fill up that emotional void and stay numb? That's what it helps to unlock.
And that you're successful in that?
Yes.
Most people are honest when it comes to things like these sessions when you're asking.
No, with hypnotherapy anyway, they're going into deep relaxation meditation.
Okay.
And
so they're already comfortably numb, as you said. When you're asking questions. And Reiki, what does that do?
Reiki is a Japanese energy healing method that we use, and it helps the person calm down and to balance the energy of the chakras. So it's
a bit of yoga, a bit of Indian info and Japanese, Indo-Japanese treatment.
Yes.
I see them all over the place, Reiki, but I don't know, the Reiki practitioners. So is it a physical thing or is it just talk?
No,
or
Reiki
aura?
is it's a breathing technique.
Oh.
So the Reiki healer or practitioner sort of breathes in positive energy from the universe, and then we place our hands on the person's chakras, and so we say that the energy is getting it's
I
flowing.
like the way you say
It's
we
flowing.
say. I mean, you're not convinced, or you say we just say this and it makes them happy.
No, they feel the energy. Actually, the hands actually get warmer,
Okay.
and that's because this energy is flowing through.
And this treatment of yours, you said, is for 3 months at a time.
Yes.
And then they go home.
Yes, they go home. Some of them.
Or do you do back-to-back sessions? In the 3 months, lock them in for another 3. Or do you see the progress in them and then decide he's ready to go home?
3 months is good time because 3 months, one is the basic thing is they've been abstinent, so they haven't taken any substance. So the physiological detox is already happening. The emotional detox is happening because they're finding out more about the disease that
And
they
you can
have.
see the change in them. Do parents, when they come and leave their children, see the change before or
Certainly.
after?
And these changes are behavioral. They say my son doesn't throw tantrums anymore.
Okay.
You know, or typically they could say my daughter's okay if I serve her, some vegetable she doesn't like. She doesn't throw a tantrum. She's calmer.
Okay.
You know, a lot of addicts and alcoholics, when they find healing, they start evangelizing about this. I've heard many young people tell their parents, you should do this program. Just the counseling part of it.
Yeah.
Because even you're stubborn, even you're stuck about certain things. Even you need to get some exercise. So the person becomes very aware, in fact hyper aware of their body, mind, emotional.
And is this a growing need in this country for more and more?
Very much.
Yeah.
It's a basic need. If you see now, there are so many self-help programs, so many spiritual programs. And the basic de-addiction program is a spiritual program because the person, we say the soul or the spirit needs to heal and come out of this.
No, what I meant to ask was, is there such a huge demand that there should be more and more of your type of institutions, or are they actually available in every city?
There's a rehab opening every day. And people who come out of alcoholism or drug addiction themselves feel inspired to open rehabs. The sustainability is very low. It's, because it's in our line of work, when you see somebody relapse, when you see somebody suffer, it's very difficult, to have them pick themselves up and for you to feel, okay, let's give it another shot and another shot, another shot. Sometimes it takes many, weeks, months of therapy and many relapses. But then the person finally comes out and says...
And I guess the one who thanks you the most would be the friends and relatives of the addict.
Yes, family members. They're like you gave them a new life.
Anyway, Meena, thanks a lot for coming.
Thank you.
For having been with us. I really didn't know anything about drug addiction. I know that there is rehabilitation, but what really goes on,
Yes.
and what does it cost? Half the people might not put them into care or therapy, wondering about how much it'll cost. So
Yes.
a lakh a month, and you say that's a well-run place
Yes.
at 100,000 rupees a month. But so maybe technically 3 lakhs would see them on some kind of better footing.
Certainly.
Yeah. You can't say, I guarantee you this guy's...
Better footing is the starting point. A brand new life is
That's the ultimate.
Yes.
So, thank you for coming.
Thank you, Madhav.